Great. So let me do introductions first of all. For a bit of housekeeping first. So when people are obviously we ask people to put their microphones on mute for the time being, and then unmute yourself if you have a question to ask. If you have a question to ask, if you can either put it in the chat, and we'll come back to that later, or else put your hand up as well, and we'll come back to it on the Q&A session at the end, and people can ask their questions in person then as well. So feel free to use both functions, and we'll monitor that throughout. So that's the first part. So let me introduce first of all myself, and I'll go around to Rahana and Rona after that. So my name is Brian. I'm a consultant psychologist, and I'm here today I'm lead at the eating disorders pathway across East London, but today I'm in a CAP coordinator on the ELFT side of things. So this is kind of position that myself and Rona share. So we both kind of share the role of CAP coordinator, and Rona has the UCL side and the university side, and I have the ELFT side, the employment side. So we can tell you a little bit more about that as we go along. But I'll hand over to Rona next, and then Rahana.
Hi everyone, great, we've got a lot of you joining us, so this is fantastic. We hope this is going to be a really helpful session for you all, and we do have Q&A at the end, so please hold on to those questions. But as Brian said, I'm on the CAP coordinator for the UCL, more of the sort of HEI training programme side of it, and my more substantive role in ELFT is as a consultant clinical psychologist and training lead for psychology and psychological therapies, and I'll hand over to Rahana.
Morning everyone, I'm Rahana and I am one of the CAPs in training for ELFT.
Great, thanks Rona and Rahana. So just to provide a little bit of context, so I'll keep it as brief as I can because I think we want to get onto the kind of the meat of the presentation really. So this is our agenda for today. So we're going to be talking through kind of the recruitment update timeline of a CAPIT, so CAP in training, clinical associate in psychology. What does a CAP in ELFT do? So a day in the life that Rahana is kindly going to speak to. And then we can tell you a little bit about the recruitment, so what we're looking for and some applications and interviews and so some tips on interviews and applications. And then we've got a Q&A session then at the end. So just to mention briefly, if we'd be keen for people to have their webcams on if possible, so we can kind of start reading the room a little bit and seeing if we're kind of hitting the mark maybe for engaging or not. But as I said, please feel free to put either your questions in the chat function or else raise your hand. We'll come to it at the end of the process. So just a little bit of context. So at ELFT we've got this year we've got four places for training places, or apprenticeship places even I should say, and possibly a fifth one coming online too. So they're kind of in various settings across ELFT. So they're some part of the community transformation project, some are in maternity mental health services, others then are in kind of more standard CMHT or psychotherapy services. So they're the kind of positions that we have this year. We're calling it an apprenticeship because it's different to a training post, and I'll just very briefly touch on it. So so unlike a training post where you're employed centrally in the NHS and you do kind of placements across different settings across maybe East London or other trusts, as an apprenticeship then you're actually employed by the trust. Rather than employed by the kind of NHS in general. So as an apprentice, you're employed by East London Foundation Trust, and part of your contract and employment will be completing the university course, the Master's University course from UCL. So we can yes. So that's the difference from a training position as an apprenticeship post. The application. So we'll be putting out the adverts in the coming weeks. We hope to have everybody recruited, so everybody having been offered a post and handed in their notice and served their notice period. We have hoping to have people in post by late November or December, and that'll give enough time then for people to be able to kind of do inductions and then start on the UCL Masters course then in come January time. The start date, I think, is the 12th of January with UCL. So it's going to be, so hopefully that kind of month and a half will allow people to kind of settle in, get to know teams, and do mandatory training, and also then to register in UCL. So what we're hoping to do, and just to say that the apprenticeship role is a standalone 18-month contract that's offered to staff as well. That's how apprenticeships kind of are run. So you're employed by the trust on it's going to be a band 5 basis for an 18-month period then, and that's from your contract starts then to the very end of the course then. So the course is usually 18 months long, and we can tell you a little bit more in detail about the course as we go along. So see, I think the next thing to say maybe is to hand over to Rohanna. Maybe she can give you a bit of context as to what a day in the life looks like as an apprentice, a CAP in training in East London Foundation Trust, and then we'll go on to. So Rohanna, I'll hand over to you, if that's all right.
Yeah, so on a typical clinical day, the first portion of my day would be reading up on patient notes, risk information, and checking the team email to see if client has contacted, just so we're on top of, the safety side of things. And then at Myland Hospital currently, we've set up a kiosk so that people who might be experiencing digital poverty or don't have a confidential space, they can come in and access an IT kiosk. So I would be setting up the technology for that and letting the service user in for their session. And then I might be discussing a plan at about 9:50 for the session and conduct a joint assessment with a clinical psychologist. And then from about 11 to 12, I would be writing up clinical notes, letters, and related emails for that assessment. And then between 12 and 1, I have clinical supervision, where I discuss my clients, any potential issues or barriers. And then between 1 and 1:50, it would be client admin, writing up assessment reports, letters, risk forms, booking appointments, making referrals, that kind of thing. And then from 1:50 to 3 o'clock, I would be discussing and planning an assessment, and then carrying out a joint assessment with a clinical psychologist in the service. Between 3 and 3:30, we would write up clinical notes, letters, and related emails. From 3:30 to 4 o'clock, we have a team checkout. And team checkout is normally where service users who may have called or emailed on the day get brought forward within the team and discussed, so that we can figure out what actions to take forward, to discuss annual leave or get opinions regarding clinical decisions. And that's just so that the responsibility of clients or safety or risk is placed on the team rather than the individual, so you get maximum support. And then between 4 and 5, I would be writing clinical notes and finishing up any kind of letters and booking appointments. Other things that I might be doing. So that's a standard clinical day, but I also have other things that I might be doing. For example, I've done some co-production work with Experts by Experience on developing psychoeducation workshops, in particular on body image. And I've also done one for young people with the Recovery College, working with one of the Recovery College tutors. And alongside that, I've also, with another CAP colleague of mine, worked with the Bangladeshi Mental Health Forum, which is a local community organisation in Tower Hamlets. And we focus on, what's important for them at the moment, for their demographic in terms of mental health at the moment, and what's important for us as a service in terms of retaining that demographic. And we come together and develop a piece of work and then deliver it within their forum. For a standard university day, it's normally broken up into 3 sections. In the morning, we'd have a lecture. So, for example, the role of co-production in services. And then between 1 and 3:30, we'd have a workshop on conducting assessments. And particularly, we might look at considerations and complications of assessments. And then 3:45 to 5 o'clock, we would have seminar where we might role play, for example, on managing risk and assessment. And actually the layout of this is quite nice. You're not spoken at the whole way through. It's broken up. We might have breakout rooms. We'll have activities to do during the day and things like that. In terms of the outline, it's 9 modules altogether. The first module is kind of an introduction, and then we go into assessment and engagement. And then we go into interventions. So we go into the fundamentals of interventions, then the implementation of the interventions. We've got a module on quality improvement and audit, a module around our dissertation, and then we've got a further module on intervention, which is more on the advanced side. We've got a module on developing as a practitioner, and then the clinical portfolio and endpoint. And Brian's very helpfully put in a link in the chat to the prospectus, so you can see those in more detail.
Great. Thanks, Rana, for that. Rona,
Right,
you wanted to
can I just sort of jump in there just quickly, because I think that's
Sure.
you know, Rahanna's really sort of set the scene really well about what kind of work and the sheer variety of work you can be doing as a CAP in training with ELFT. So, you know, but I think the some of the sort of keystones on that is really what you're doing is you're really getting into intervention based work in all different sort of areas of the client experience, and you're very, very much embedded in a team. So you really are, and this is what a lot of feedback we're getting from CAPITS is about, is that one of the strengths of it is throughout your training, you really are embedded and you are part of that team. And you can see from Rahanna's what she's explained about all the different activities she's doing, is there's a huge variety, because what we're really interested in is making sure that what the service users are receiving in terms of psychology is what they need to receive. Yeah, so that means that the CAPITS really are working in very, very close proximity, applying psychological knowledge and know-how in a really sort of close way with the team and with service users. That in the past, when psychology has just been provided by clinical and counselling psychologists, that can be a little bit remote. That's where it can get into waiting lists and waiting times. Does that make sense, Rahanna, for you, that it feels that as a CAP, your psychology is much more accessible to service users, and you know, you can really kind of explore all the different ways that you can apply it?
Yeah, 100%. I would agree with that.
And then just the last thing, in terms of the program really has to sync on to what the CAPITS will be doing in their day-to-day work in the NHS. Okay, so everything that you are learning in every module, you then have to at that time apply that learning in your clinical work. Yeah, so it all nicely syncs and balances up. Okay, I'll stop there.
Oh, thanks, Rona. That's really helpful. I was just thinking as well, it's not only the kind of clinical work that you apply it to as well, it's just as the research and audit module as well, and quality improvement as well. It's thinking about that kind of systemic view as well, and how well things are working maybe, and what improvements need to be made, and that kind of iterative cycle, I suppose, that services should go through really, but actually some services can get stagnated and mightn't necessarily go through. So I suppose that's one of the key things with this kind of workforce with CAPS as well, like you're saying, to be kind of professional applied psychologists, but also to have that kind of systemic lens as well over a system and see how things are functioning too. So it's a really nice training in that respect. So we can answer any questions about kind of how the two interface, but really during the training years, Rona said, like it is about kind of gaining all these experiences and the trust, trying to support its employees, its apprentices to gain this experience as they go along. So at the end of the course, that they have various skills and a really wide skill set. So from kind of structured clinical management to, you know, this year was kind of DBT skills and MBT skills and so forth, plus all the kind of research element and audit and QI, And then kind of at the end of it, then can with support obviously can fit into where the need is within East London Foundation Trust, which is fantastic for the trust, I think, and for the experience too. So the next item on the agenda was just thinking a little bit about recruitment. And Rona, I might hand over to you for this. So just to contextualize as well, for this year, as I said, there's 4, if not 5 places this year. They're going to spread across all different services, as I said earlier, and recruitment is going to be pretty imminent as well. So yeah, so I think in the next definitely this month, adverts will be going out, and the recruitment process will be starting. So I might hand over to you, Rona.
Okay, so yeah, so what are we looking for when we're going to be looking at these application forms and shortlisting and interviewing? So something that's really important to say is it's not so much what you've done, it's about your capacity and your ability as psychology graduates to be able to see and understand psychology around you. Okay, so really the point of the CAPIT role is to offer a role to people who haven't necessarily been able to have the opportunity or afforded the experience to do lots of kind of clinical work, lots of clinical experience, for example, in honorary post, or having worked with clinical or counselling psychologists. What we're really interested in is in whatever area that you've worked in, that you've been able to spot and apply some of your psychological knowledge from your psychology undergraduate degree to your surroundings. Okay, so if I give an example, I don't know if any of you work in admin or have worked in admin in the NHS. So for example, the waiting room area, there's tons of psychology that can be seen in a waiting room area. If you just start to think about how welcoming is that area, how psychologically safe is that area, that's the first place that somebody's coming in. It's the beginning of that kind of trusting relationship that the clients might be forming with this service that they're going to have. There might be lots of anxiety generated in that area. There's culture in there. So do you see what I mean? So we're really, really interested in your applications, your ability to kind of see and recognise psychology just in sort of day-to-day life, because for the service users coming into the NHS, the psychology they have is not just in the room with the CAPIT or the psychologist, it's every step of the way, the whole referral pathway. Okay, so that's what we're really interested in, is you as just sort of psychological people. We're also interested in lived experience, because we all have lived experience, okay? And the days where we have to sort of separate ourselves out, the personal side of us that might have a lived experience, for example, of a mental health problem or emotional distress, and the professional side of us. So we're very much interested in your lived experience too, either personally, or I'm just going to let somebody in there, either personally or with, as you may have experienced as a carer. Okay, so that's part of sort of the ability to bring together the personal and the professional. Okay, we're also in CAPITS very interested in diversity and your experience of that, or your understanding of that. If we just think about the psychology profession itself, for many years we've been working at trying to address the issue of diversity, because the clinical and counselling psychology profession is not a very diverse one. It's not very representative in terms of the demographics of clinical and counselling psychologists of the populations that we serve. And so we're really interested in diversity in all its aspects. We're interested in ethnicity, in sexuality, in gender, in age. So we're very much interested in your opinions about that, in your experience about that, in how relevant you see diversity in clinical psychology practice. Not just with CAPITS, we want to make sure that with this profession, that we get it right from the get-go. Okay, that with CAPITs, that we make sure that we are recruiting a diverse population who are representative of the community that we serve, but also that in doing that, that we also recognise diversity amongst our communities, and that our psychological practice also can accommodate, can be accessible to that, can be inclusive to that. Okay. Co-production, we're looking for people who have an understanding of co-production and an interest in it. Co-production is increasingly important in the NHS, but really in ELFT is something that we very much foster, and we try and kind of live day to day in how we deliver services and how we design them. So some of you might be aware of co-production, but just as a starting point, I'd advise you to look at the co-production ladder if you're not familiar with it, to really understand what we mean by co-production. And by co-production, that means that we're working, again, not at distance, but we're working in proximity with our service users and our carers and our communities, to think with them, jointly with them, and to work together from the get-go about how do you want services to be? How would you like them to be delivered? Where would you like them to be delivered? Who would you like to deliver them? And also co-production, in that we increasingly have staff members who also with lived experience who are co-facilitating and delivering services, for example, groups with us as well. So we're really looking for people who kind of understand co-production and how important it is in the role of psychology. Transformation is something that Brian sort of referred to it earlier on. Some of our CAPITs are working in the transformation projects, and that's very much in co-production, looking at changing and transforming our services so that they are delivered in a more meaningful, relevant and accessible way to our communities. And again, a lot of that is about trying to get rid of the barriers and all these major steps that sometimes service users and carers have to get through, the hurdles to get to psychology. What we want to do is break down the barriers between somebody's access to a psychologist or somebody with psychological knowledge and know-how, and they can get to them far quicker, and they can have an intervention that's really going to help them at the right place and the right time. Okay. Trust values, it's really important that you know about the trust values. So we care, we respect, we are inclusive. Okay. And just making sure that in your application and in your interview that that's something that you're also conveying. Okay. Complexity. Just finally, the CAPITs are fantastic in terms of it really is a role that really embraces complexity. Okay. And by that, what we mean is often our service users and us ourselves, we're more than one thing. Okay, so we might come to a primary care network and we might be saying that our main priority might be our mental health and well-being, but actually we're more than that. We're the sum of the parts. So a lot of our service users might also have physical health conditions. They may have addictions. They may have issues around housing and homelessness. Yeah, they may be experiencing stigma and discrimination in the community. They may have caring responsibilities. So we need to understand the whole person in all their complexity, rather than kind of just attend to the little bit that's our bit and sort of send them off to other services for all the other sides. And that's why it's really important in the primary care networks that we try to come together in all the sort of MDTs, the multidisciplinary teams, all the different professions come together in order that it's their role to understand the complexity, okay, and to think about what kind of interventions should be offered to the client, in what order, and as part of the co-production, you involve the client in that as well, okay. And that's something that I think Rahana was sort of referring to when she was talking about part of her day at Dean Cross, is they have that end of day checkout. And that's part of the teams getting together, because it's their responsibility to think about the person in their entirety, okay, and not just a specific part that they might just be working with at that time. Okay. So if I'll leave that there, and if people have any other sort of questions, we can check that out at the end. And I'll pass back to Brian now, who's going to go through the application and interview tips.
Thanks, Rona. Yeah, really helpful. We're going to have about 20 minutes at least for questions at the end, folks. So make sure and have them ready, and make sure and use this form, I guess, to ask any questions that you need to as well, if you are thinking of applying. So the first thing I suppose to say about applications is just make sure that you do as much reading about the position as possible that you're applying for. Make sure that this is the career that you like and want, I suppose, and kind of feel connected to. At the end of the course, you're going to be skilled in delivering interventions. You're going to be skilled in, you know, complex formulation, etc., etc. But what you're not going to be, and I think it's important to kind of clarify, you're not going to be a psychotherapist at the end of it. You're not going to be kind of a psychotherapist in that way. And so I think if your passion is kind of about co-production, working with communities, working with complexity, delivering interventions, etc., then I think it sounds like that that's a position that would be useful for you, and, you know, I'd encourage you to apply. So that's the first thing. So have a look on the UCL website, have a look on the curriculum, and think about what that curriculum is going to give to you as a practitioner. And we're really keen for CAPs, for clinical associates in psychology, that they're going to be a profession in their own right. They're going to complement the other psychological professions and the other kind of mental health professions across the trust. But they are going to be a profession in their own right, with their own dedicated skill sets and their own kind of, you know, developing leadership capabilities too. So I suppose just make sure that this is the pathway for you. The other thing, just touching on Rona's point about the first point here, it's not about what you've done. It's about in the application, about showing us who you are and what experiences that you've had. We're not only interested in clinical experiences, we're also interested in people's experiences, maybe in growing up in East London, if people are from East London, about coming from particular maybe socioeconomic backgrounds, certain cultural backgrounds, etc. And what does that mean in day-to-day life, and how might that impact, I suppose, on different cohorts of people. So it's really important to make sure that when you are thinking about the application, that you're really getting across who you are and what you kind of believe in as well. I'll breeze through the next kind of couple of points, but it's always good to kind of, if any questions, to contact the recruitment lead for more information. If there was kind of points that you wanted to discuss in general about the post, to make sure it is the post for you. That to make sure that you look at the advert that goes out and read the advert carefully and think about what the advert is looking for, but also about the job description and personal spec as well, that you're actually looking at that and thinking, you know, let me give some examples around the main areas in the job spec and job description and personal spec. The 3 reasons for applying is a prerequisite of applying in East London Foundation Trust. So everybody needs to make sure that those 3 reasons for applying are right at the start of their personal statement. And it can be a case where if people haven't done that, then people won't be considered for the post. So just make sure and read the fine print carefully. It's also important to think about, from somebody who is going to be shortlisting as well and going through all the applications, that this is going to be the first bit of text that they're going to read about you as a person as well. So these 3 reasons for applying. So it's important that you really foreground you as a person in these and your kind of, you know, lived experience, but also your professional experience in those kind of 3 main points at the start. The next point about kind of amplifying your attributes, just, we're not looking for people with only for people with tons and tons of experience clinically, say, but really looking for people who can think really and think psychologically, and that's the main thing. So I think that needs to be one of the kind of fundamental attributes that you're kind of showing in your application as well. We're really, you know, really keen to find people who can see the psychology in everything, like Rona said earlier on as well. So irrespective of what positions that you've had, irrespective of kind of where you are in your career maybe, but that you're actually thinking about, you know, even everyday interactions with friends, and thinking about kind of what are the dynamics between people and what can you see in your social environment as well. The next point is, I think one of the most important, is about kind of sharing your experience of complexity. So maybe dealing with complexity, irrespective of what jobs that you might have or previous experience. So when have you come across, you know, complexity? And by complexity, I think maybe we can also think about, reframe that and think about maybe people who have multiple needs as well, and varying needs too. So it's so we can all, you know, I think we all have different needs as people as well, and have sometimes kind of many more needs than at other times as well. So it's important. In terms of mental health, we're looking for people maybe who've experience of working in mental health settings, but ideally, I guess it'd be fantastic to have people who have experiences of mental health services at first hand, who have been have used mental health services, or maybe their loved ones have used mental health services, and are really able to draw on that experience from multiple perspectives. So from a maybe service user or care perspective, but also as well from a professional's perspective, then I suppose flipping the role and actually what can you bring that's different given those experiences that you've had, and the challenges that you face as well. It's important to kind of to outline those and to make sure you come across in those challenges as well. Then it's also fundamental to share why you think this apprenticeship is for you, and why this apprenticeship, why not something else. And I suppose that enthusiasm and that passion needs to be communicated. And so your personal statement and your application really is a really key way of doing that, of really shining a light on why you are the person for that post and not somebody else. And the last point as well about it's our first opportunity to get to know you. So we won't know your name, we won't know your age, date of birth, anything like that. But your personal statement is the first point where you can actually communicate who you are as a person, what you believe in, and what kind of why you are the person for the post. A couple of tips, I suppose, is don't think about or maybe don't focus only on NICE guidelines. And probably everybody knows what the kind of NICE guidelines are, you know, for clinical excellence, but maybe think about other areas where you can gain information. So thinking about the NHS 10-year plan and what that's saying, and what the future for mental health services is, you know, King's Fund papers, stuff from Nesta about co-production, etc., and really kind of think about these items and make sure you communicate those in your application. With regards to the interview, so we can come back to kind of any questions people have on the application process. But with regards to the interview, just wanted to mention a few key points. One is that it's not a test, and it's not trying to catch you out, and it's really important to understand that the questions are being asked to really try and elicit who you are and who you are as a person, what you stand for as a person. It's important to kind of balance saying as much as you need to answer the question and time management at the same time. So at the start of the interview, it's going to be communicated that maybe it's a 35-minute interview and there's 7 questions. So then I guess it's really important for people to take that time to kind of work out, okay, so that means it's about 5 minutes a question then. So really work out how long you have. Don't be afraid to look at a timer that you have, and also don't be afraid to write down the questions. It's not a memory test in the interview, and we just want people to really understand the question and answer the question to the best of their ability. So if it means jotting down points, making notes, etc., that please do that in the interview. Rehearsal is key, and I think talking through some questions that you might think might be asked with friends, with colleagues, etc., is really important. Just get used to talking about yourself, especially maybe if you haven't had roles as an assistant psychologist or in psychology before. I guess some other professions really want people to be really succinct and, you know, not kind of not laboring points, that's the wrong phrase, but actually not go in depth into answers and to be very succinct. But I suppose we really need to get to know you as a person through the application, but also in the interview. So it's important that you take the time to answer the question well, whilst also paying attention to the time management part. Ask for questions to be repeated and clarifications. That's absolutely fine. The interview is going to be online, most likely, given the current state of affairs. So we know that technical issues happen during interviews, especially with modern day technology. But I suppose it's really important that you're as prepared as possible and you do everything to make sure that it all goes well as possible. We understand that the technical issues happen and can happen during interviews, but that doesn't mean that people won't pass an interview because they had to log in again or their internet failed as well. Yet at the same time, I guess it's really important that you show your professionalism by logging in, by being on time, etc., and being professional in that sense too. Yeah, and it doesn't matter whether you've worked in psychology or not before. As going back to Rona's point, it's important that you show your psychological knowledge through maybe the previous professions that you've had and experiences that you've had, etc. But the questions are going to be open enough that anybody can answer them, even if they maybe haven't necessarily worked directly with service users before, say, or in a psychology service. So it's important that you know, to communicate that too. So it's not about trick questions or anything like that, or knowing particular knowledge. It's about communicating your experiences, who you are as a person, and what you stand for. And then finally, the panel, all panels in East London Foundation Trust will have an expert by experience on the panels. And it's by no means a tokenistic gesture or anything like that, that the expert by experience have you know, equal say in marking the interviews, but also from my experience have given some absolutely fantastic insights. So it's just important that yeah, that's acknowledged too, I think, and the importance of experts by experience, you know, service users, family, friends and carers, not only in the interview process, but also in the job, and also kind of recreating services or creating services as well to fit the needs of the population. Very briefly to say, we're extremely interested in people with lived experience, people from various backgrounds, people kind of, you know, living in East London and know the areas really well and so forth. And we really want people who are kind of passionate about the profession as well. So make sure and do kind of reading up in advance and make sure it is the profession for you. Anything to add, Rahana or Rona?
I don't know if you've got, I don't know if others can see it, but I can't see the slide on the interview tips. I don't know if that would be, there we go. Exactly. Yeah. So yeah, just so people can see the headlines for that. Great. And I guess the interviews, you know, it's that combination of, on the one hand, we want to see that you know what you're talking about in terms of you've done your research and your preparation, you know what the CAP role is, you know what it involves, you know about co-production, you know about diversity, you know about the NHS's sort of direction of travel now with transformation and the 10-year plan. So we on the one hand, you know, we want to see that kind of knowledge. And on the other side of it, we want to see you. Okay, so the way that you talk about it, yeah, how you map some of that onto some of the experiences that you've had, either sort of work or in other areas. Okay, so kind of keep that balance. And the other thing to pick up on, and the sort of 3 experience and 3 qualities. This is, I'm sharing my tip for interviews. I'm not sure if it's sort of, I haven't ever asked interviewers if actually it's been dreadfully helpful, but it's something that I do. So I always sort of think before an interview, what 3 qualities, what 3 attributes at the end of the interview do I want the interview panel to kind of summarize me as, you know? So if they were asked at an end of an interview with me, what three qualities do you think Rona's got, that they'd guess the 3 that I was trying to convey. Okay, so if you want to, I don't know, if you, one of your qualities is you want them to understand that you're a curious person, okay, or an empathic person. So just think about the 3 qualities about you, and just when you're doing the interview, you're preparing for the interview, just kind of make sure that you're sort of showing that, because often it's in the verbals and the non-verbals, yeah, that you're getting that across, yeah, so they can kind of get who you are. And then the other thing is, sometimes we have sort of experiences, things that kind of demonstrate our knowledge and our know-how or who we are, and then at the end of the interview we think, oh my god, I forgot to mention that, I forgot to say that one thing. So just maybe think about, what are the 2 or 3 key things that I want to make sure in answering the questions I kind of get that in there. And the last thing I'd say is, don't expect us to remember everything you've put on your application form. The application form just gets you to this next step. And whilst before the interview we'll have a quick look through the application form, we're not going to remember everything that's in it. So feel free to mention some of that stuff again. Okay? Yeah, don't leave that out either, okay, because you've spent a lot of time in your application form, so bring that into the interview as well. And you can also refer back to it and say, you know, as I mentioned in my application form. Okay, so that's just the last little bits I'd add in. I don't know if Rahana, you had anything, because it's about a year ago, isn't it, since your last one that you had?
Yeah, I think just to say, a lot of people can feel apprehensive about bringing forward protected characteristics into an interview or into an application, but it's really important for this role that you do highlight how you might meet the diversity and inclusivity or lived experience, or how familiar you might be with East London, and really bring that forward in both your application and your interview. It's not something that you're going to be judged on, but in essence, if you think about the fact that we're trying to transform services and make them as accessible as possible, we're looking for people who know East London and know what some of the barriers might be and how we might start to improve that.
Thanks, Rihanna, and apologies everybody for not showing that slide of interview tips, but we'll make the recording available and people can rewatch it or get the slides. Time for questions. So we've got about 17 minutes for questions. So any questions from anybody, and feel free to ask myself, Rihanna or Rona questions as well, I guess. So and we'll do our best to answer them. So I don't think there's no questions in the chat so far. Let me see. Nothing in the chat. But did anybody kind of want to raise hand and ask any questions? Yeah, Farzana.
Hello, this is Farzana. I wanted to know, I mean, when is the time period we have to fill out the application form, and is it everything in the website? No,
so it's not. It hasn't. The job advert hasn't been released yet, but okay. It's going to come out sometime this month. It's going to be through NHS Jobs as well. So if everybody can set up an alert on NHS Jobs for those positions, it's going to be clinical associate and psychology are going to be the key terms that you want to.
So it won't be in the UCL website.
No, it won't be in the UCL website. No, it's going to be through. It's East London Foundation Trust will be the employers. Okay. So the successful candidate will be employed by East London Foundation Trust. And then 2 days a week of their time, they'll be going to university doing the MSc course. And then the other 3 days a week, then they'll be on the job working on the job. Yeah. So there's Yeah, so there is so NHS Jobs is the website, and Clinical Associate Psychology and East London will be the key terms that you can put for searching.
Okay, thank you.
So we've got a couple of questions in the chat. Anybody else? Tyrone, you want to come in?
Well, I was going to say, yeah, so Lucy's very helpful question about BPS accreditation and registration. So there will be a BPS register for CAPITs, and CAPs, qualified CAPs, will be eligible to join that register from autumn this year. BPS are also responsible. So this role as a CAPIT is you're employed by an NHS trust, but you're under an apprenticeship scheme, and you're also under the sort of professional kind of auspices of the British Psychological Society. Okay, so in terms of the apprenticeship and the BPS, they want to make sure that this role, that what you're learning and what the HEIs, the universities are delivering, kind of meets all the core competencies that CAPs should be learning about. Okay, so on the BPS side, they are setting up an accreditation committee. And what they'll be doing, I think, sort of starting this year and going into next year, is they will be going around and literally visiting the universities to checking on the master's programme with the purpose of accrediting those masters. Okay, so those two things, registration and BPS accreditation, are in hand. Other questions? Shall I just sort of look through? We've got some good questions coming through the chat. So yeah, so reiterating that we're looking for people from East London. Does this mean there's no point applying if you're not from East London? I don't know if, Brian, you want to answer this, because you've been working sort of quite closely with our recruitment people to think through this. Yeah. Yep.
Yeah, no, I suppose we welcome all applications, and I think we're looking for the right candidate. And being from East London or growing up in East London isn't a defining kind of characteristic. Say that means that that you will or you won't get the job at all. I guess we welcome all applications. So this post is going to go out nationally. The things I suppose we're, as a trust, that we're kind of very much interested in is kind of thinking about diversity, thinking about local populations, thinking about lived experience, and those kind of mean a lot to us as a trust. So I suppose if people can communicate those, I suppose that will be beneficial. But it doesn't mean that if somebody's from East London and does a terrible application, that they'll be picked over, that they'll be picked or anything like that. So it's not something that is a prerequisite by any means. The other question, next question up is, and I can see Joshua has his hand up as well, and we'll come to you in a couple of minutes, Joshua. But will there be another enrolment after December intake, mid-academic year, for example, or the year after?
Hi.
Hi.
Hi, so I had my hand up. I'm Natasha and this is Josh. We're assistant psychologists in Newham Centre for Mental Health. And my question, I might be jumping ahead of things a little bit, but I've been really curious about what happens once you have completed this 18 months and once you're qualified. What is the continuation of the career?
Okay, I'd really recommend, so when we sent out this invite, we also sent out a link for an excellent webinar, 2-hour webinar, that was provided on the CAPIT role, that involved universities that are providing this, trusts that are providing this, and also 4 or 5 CAPITs talking to their experience. So if you haven't watched it, please do, because it covers some of these areas. And but for us in ELFT, and this was brought up in that webinar. So once you qualify as a CAP, you've got choices. So you can stay working as a CAP. So you can stay in that band 6 post, and that is your career, to work as a clinical associate in psychology. However, there's also career progression. Okay, so we want to make sure that, just like any other professional post, that you have access to leadership opportunities. to management opportunities. So you might want to go down that route. You might want to go down a clinical specialism route. So whether, like other professions, you might want to do another postgraduate training, okay, to enhance your kind of repertoire of what you can offer. And what else? Yeah, and we've also got I think the psychological therapies route, so whether actually you do want to get into the therapy side of things. But there's certainly, you know, different sort of career progressions that people can go into, and I think more and more in ELFT we're wanting to make sure that those opportunities, for example, to become a team manager or to get into corporate leadership or to go into a specialism, is accessible for all different professions, okay, and CAPs are kind of one of those we want to include in that.
Thanks, Rona. I'll put a link at the end, or I have a link at the end of the slides, just in terms of the useful links. One just in UCL, and then about the talk that Rona was speaking about there. So we went out in the invite too. So I'll put that in the slides here. Enrollment after December intake, mid-academic year, for example. Do you know, can you answer that one, Rona, from Sophie Evans? So will there be another enrollment?
So our HEI, which is our university that provides the master's programme for ELFT CAPITs and also for CAPITs from other trusts, that's UCL, and their programme starts on a January and finishes 18 months later, I think around in August. So that's every year on a January. Now, there are other universities that are interested in this as well. UEL is also a university that's interested in putting on the master's programme. However, that's in very early stages. So there may be some universities who will also put on master's programmes, and they might put those on at a mid-year point. Okay, but at the moment, in terms of what's confirmed, it's UCL and it's every January. So our next intake, as Brian said, is January 2022. Did we miss, I'm just thinking we can go through the chat, but I'm also wondering, did we miss Joshua, who did have his hand up? Joshua, did you want to ask your question?
No, I think that was the question that was just asked.
Oh, sorry.
Yeah, Joshua was there as
Joshua,
well. Yeah.
You were both in the same room. Sorry there.
Yeah.
The other thing was, in one of the questions, it was a two-part about that. Somebody asked, are there qualified CAP positions within the trust? Yes, they are. We have a very sort of, our first year cohort was very large at 17 CAPs in training, and we will have, we're pleased to say, kind of 17 qualified CAP posts that we'll be putting out to advert to sync in with their time that they qualify. I was wondering if you could speak, this is Katie, I was wondering if you could speak about the recent changes to Declan Psych funding and how this affects CAP internship and career progression following qualifying as a Band 6. I don't know, Katie, if you can speak a little bit more about the change in Declan Psych funding, just so I can kind of understand.
Yeah, hi, sorry, I don't know, can you hear me okay?
Yeah.
So I think they just released saying that for PWP roles and for CAP roles, you have to kind of stay in the post for 2 years before applying. And I think you kind of just answered about what career progressions there kind of could be following being a Band 6. I guess I was just wondering, without additional training or kind of entering management levels, is there like opportunities to progress beyond a Band 6 whilst in the CAP position? Or, yeah. So I feel like you're kind of deterring against applying for the Declan side, which is fair enough to kind of make it, Yeah.
So the last question you asked, you know, moving from banding, if you move from one band to another, you would need to apply for a new post. But certainly it's about you developing, whether, for example, if you wanted to get into leadership and management, developing that through CPD and certain programs you can be on with ELFT that then makes you eligible to apply for more senior positions that would be at a more senior banding. In terms of, yes, that's a very live and current question now about CAPITs, and if you, HEE funds, they fund CAPs in training. with the idea that you're going to then become a qualified CAP. So there's they put out this statement that if somebody, after qualifying to become a CAP, then applies to go on another professional training to qualify in another professional, whether or not they would fund that. So actually yesterday I was talking to UCL, and they've let me know that the universities are in discussion and are picking this up with HEE about this ruling, hoping that there might be an opportunity to amend that. So we're waiting for HEE. I've heard that HEE is listening, and that we're waiting for a view and a decision to come back to them on that. Okay, just where we've got a few more minutes. For the word personal statement section, is there a word limit? I think there is. It's extremely generous. I wouldn't. It's good to do about a page, maybe an A4 size. Okay, I think if you start to go over that, you might lose the reader a little bit. So I'd caution against people using the full word limit. Okay. Will there be more roles available? There's only 4 currently. We're hoping that there's definitely 4, possibly 5. There's no more roles than that coming up for the January UCL intake, for the next intake. If we pass the interview stage, do we have the option on where we will be placed in the trust, or will it be random? I guess this is a bit of a balance. So I think how we did it before, and Brian Rahani, you might want to step in, is that people could make their preferences. Okay, but the fundamental thing we have to think about is that we are a service for service users. Okay, so that's the priority for need is there, but we do of course take into account people's preferences. People may have other commitments in terms of which borough they might need to work in, for example, if they have carer or other commitments. I don't know if Brian or Rahana, you've got anything to add to that question.
No, I think you're right, Rona. Yeah, that's how we did it last year. We tried to match people's skills as well and their interests with roles as much as we could, given the limitations too. Because obviously, so from an employer's perspective, we know that people who are interested in the roles or have a particular interest generally are kind of show more enthusiasm in the job, or can enjoy work more, I guess. And so we're really keen to support people in that as much as we can. Yeah.
People have just got time. There's one last question about what's the criteria for enrolment. Is it Nadakuba just explain a little bit more what you mean? Are you meaning enrolment at university, or?
Now, what I mean is what I mean by the criteria is the minimum criteria for enrollment is not the university, not the undergraduate one. I mean for the postgraduate.
Yeah, so anybody who's going to apply for the post, they need to have at least a 2.2 second class honours degree in psychology at an undergraduate level, and then you can apply then for the post. So you need to have the eligibility to apply for graduate membership of the BPS. You don't have to be a graduate member of the BPS, but you need to have completed a BPS accredited undergraduate degree in psychology and achieved a second class honours, and then you can apply for the posts.
All right, thank you.
No problem.
And then last question, we'll take this last question from Ella, because it's a good one as well. So the applications are open for a certain amount of days. So when you signed up with NHS Jobs and you see that post come up to advert, it will have a closing date on it. So be aware of that, but also be aware that with ELFT, it closes after 50 applications have been received. Okay. So if it's hit 50 applications, it will close early. Okay, so for this reason, because it's going sort of nationally, I'd probably advise you to try and get your applications in good time before the closing date. Okay. Brian, I don't know, you set everything up. I don't know if you want to kind of close the session for today. And
sure, only just to touch on that, people can start working on those applications now. You can update your NHS jobs, your employment lists. You can start thinking about your personal statement. So everything could be quite ready to go, almost ready to go, apart from some tailoring maybe to. So the application will come out. It's going to be this month, so it's not going to be next week. It's probably going to be towards the end of the month, either the second last or the last week of the month. We hope to get it out. So that's a couple of weeks yet. And the final question is about today's recording. So we'll our comms team, the East London Foundation Trust Communications team, will be putting it on the Trust YouTube channel, as far as I know. So I'll be sending them the recording today. So we can, it'll be posted on the YouTube channel most likely. Great. So we really appreciate people spending their time asking their questions. Thanks very much to Rahana for taking time out as well today and presenting, and to Ronan as well. And yeah, I would just encourage anybody to read up more about the profession, and make sure that that you put yourself into your applications and your interview. We're interested in you as a person, because you will be the person doing the job at the end of the day. So yeah, best of luck, and we look forward to reading personal statements and hopefully interviewing many people that are here today. So yeah, thanks a lot to everybody. Have a good day.
bye everyone.
Take care. Bye.